Then we come to malignancy. So mostly when you look at the lymphatic lymphoreticular system that we look at, there could be infection. That's why we looked at reactive lymphadenopathy. But majority of the things that affect the lymphatic or lymphoreticular system will be malignancies or tumors or cancers. And of course, tumors can be malignant or can be benign. It doesn't always have to be. But majority of the things that we talked about here will be malignant. So when there is one we call non-Hodgkin's lymphoma, probably the Hodgkin's with somebody who discovered this or first described these types of cancers. So it's called Hodgkin's. So we have non-Hodgkin's lymphoma, as unlike the Hodgkin's lymphoma that we're going to look at. And remember, in Hodgkin's lymphoma, we have those cells called Ritz-Steinberg cells. But in this case, in the non-Hodgkin's, we don't have the Ritz-Steinberg cells. So non-Hodgkin's lymphoma can be derived from B or T lymphocytes. Those lymphocytes, either B or T. All of them are malignant. So you can see, although he's talking of, I remember when we talked about how to classify and how to name tumors, sometimes if you find OMA, it will tend to suggest benign. For example, you can talk about lipoma. It's a benign tumor of fat cells. But in this case, when you look at lymphoma, although it's ending with OMA, it is malignant. Yeah, so these are some of the exceptions to the naming that we talked about last time. So in this case, lymphoma is a malignant. So all non-Hodgkin's lymphomas are malignant. And most of the thing that you will find when you examine somebody with a lymphoma, with non-Hodgkin's lymphoma, one of the things that you will find among other things when you examine the patient is painless lymphadenopathy. So you have enlarged lymph nodes that are painless. So when you palpate, they don't feel pain. So they are not tender. So they are painless lymphadenopathy. So lymph nodes are enlarged, but they are not tender. They are not painful to palpation. So painless lymphadenopathy. So may be localized to one nodal group or widely disseminated. So they may be in one place. For example, they may be just affecting the neck, the lymph nodes of the neck. So you may find just the lymph nodes of the neck are enlarged, or maybe lymph nodes of the inguinal region are enlarged. So it's just affecting, it may affect one area, localized lymph node group, or it could also be widely disseminated. So it could go to other lymph nodes, or even it could go to other organs. So one of the things that we do for diagnosis, among other things, is biopsies. Mostly for cancers, always, as I told you before, we always say for cancers, tissue is the issue. You have to have a tissue diagnosis. So you have to take a biopsy to confirm. You cannot examine somebody and say they have a cancer before you take a tissue for examination. So for cancers, we say also the tissue is the issue. You have to get a tissue diagnosis. So biopsy is usually performed for diagnosis. So B-cell lymphomas are more common than T-cell lymphoma, T-cell types. So as we said, they can also be derived from either B or T lymphocyte, but B-cell lymphomas are more common than T-cell types. So B-cell lymphomas may arise at extranodal sites. So when you talk about extranodal site, they occur from other sites. They can occur from the spleen, they can occur from anywhere else. They may not necessarily occur from the lymph nodes. That's what we mean by extranodal sites. T-cell lymphomas most frequently occur in the skin and present as disease term mycosis fungoides. So this is cutaneous. So it can affect the skin. Yeah, especially T-cell lymphoma. So it may appear, when you talk of mycosis, it almost suggests, it looks like when you examine the patient, you may see like the skin appears like it's a fungal infection of the skin. That is why you talk of mycosis. When you talk of mycosis, you are referring to fungal infection. So when you talk of mycosis fungoides, they look like, when you examine them, they would appear like a fungal infection of the skin. So that is what we term it that. But basically, it could be T-cell lymphomas that is affecting the skin. And generally, non-Hodgkin's lymphoma requires systemic treatment with chemotherapy. So when you talk of systemic treatment, you're talking of things that you either take orally through the mouth, or you inject into the vein, or you inject into the subcutaneous tissue, or you inject into the muscles. that is intramuscular. So that is what we call systemic, as opposed to topical. When you talk of something being topical, it's something you apply on the skin, for example. For example, some fungal infection, you can use topical antifungals, for example. So when you talk of systemic treatment, it's something you give through the mouth or through the veins, through the muscle, and so on. That is basically something that is getting into the body. So most of them will require treatment by chemotherapy. So chronic lymphocytic leukemia is a common form. So sometimes these cells can get into the blood and it becomes a leukemia. So when you talk about a leukemia, it's basically these malignant cells. If it gets into the blood, then you find they become a leukemia. So in this case, chronic lymphocytic leukemia is a common form. So sometimes it complicates by developing a leukemia, which is called chronic lymphocytic leukemia.